Just see if I can answer this way. Student?
First question answer.
No, I'm just looking at you. Is that okay?
Namaste viewers, welcome to the Facebook live session. As we celebrate today World Obesity Day, our topic for discussion is health risks of obesity and overweight. And for our discussion, we have with us Dr. Rajnesh Reddy, Senior Consultant Surgical Gastroenterologist, Laparoscopic and Bariatric Surgeon at Apollo Hospital, Jubilee Hills, Hyderabad. He has 30 years of experience in the field of laparoscopic surgery and has set up Bariatric unit at Apollo Hospital, Jubilee Hills. Welcome, Doctor, to the FB Live session.
Thank you.
Today, as we celebrate World Obesity Day, we will brief you about obesity. So, starting with the question, sir. So, what is obesity and what causes obesity?
Now, obesity in plain words is overweight. Now, obesity is calculated by called BMI, body mass index. Now, anything over 25, you are overweight, and over 30 to 35, you are obese, and over 35, you are super obese and morbid obesity. Obesity is a very, very common now in this part of the world. India used to be malnourished, but today 30% of the population in the metros, all the metros in India are obese. 70% of the population in the United States is obese. So it's a global phenomena. It's not only just India. India is catching up with the rest of the world. As you know, obesity can be mostly if you want to describe obesity as a metabolic disease more than just a genetic problem.
So, what is BMI?
BMI, as I described, it is described as body mass index, which is calculated by a simple methodology which says height into weight, which tells you the what BMI you stand. As you see, the healthy weight is one which is within 25 BMI. Anything over that is overweight, and over 30 is obesity, and severely obesity is over 35 to 40, and morbid obesity is over 50.
So, what are the complications of obesity? Can obesity affect our health?
Now, obesity is a metabolic disease I described. Now, obesity can cause many problems psychologically. Most of us who are psychologically affected, who are obese, they are depressed, and because they are obese, now a lot of them have uncontrolled diabetes and uncontrolled hypertension. They can have heart disease, renal problems, that is kidney failure, and even cancer. So obesity also was as you know that in COVID time, obese people were more affected than the ordinary or non-obese person.
Coming towards our next question, how common is obesity? Does obesity runs in family?
Now, as I said, 30% of the population today in metros are obese, and in India, in northern hemisphere is much more than the southern hemisphere. That is, in Punjab, in Rajasthan, the obesity is much more. Basically, that tells you the kind of diet we are eating and the kind of health lifestyle we are living in. Lack of exercise, more of very high calorie content food, heavy amount of eating of fatty food, alcohol, especially the fast food, where you end up eating pizzas and burgers in excess, and that is one of the reasons for a rise in obesity in India. As the wealth is going up, I think obesity is also going up.
Okay, sir. So, what are the preventions for obesity, And what types of serious health conditions are linked to obesity?
Preventions are, of course, is lifestyle management. If you are very careful with what you eat, then you can absolutely control your obesity. As you now understand that childhood obesity is becoming a rampant than the adult because of our own problem. I think we are not giving the right food or not taking care of our children. Most of them are probably more concentrating on studies than the extracurricular activities. They don't even play sport, and wrong diet. So parents are responsible for childhood obesity. And in adults, of course, as I said, nutrition or diet is the main cause, lack of exercise. The very small amount of people do have genetic problems or hormonal issues.
Okay, sir. So, what are the treatment options available for obesity, and can obesity be cured?
Now, obesity is, first of all, is lifestyle changes. If somebody can, be careful with diet, cutting down on carbohydrate, cutting down on sugar, cutting down on a lot of fatty food, red meat, and these are the common causes for increase in weight. We require probably not more than 1500 calories, and if you eat more than 3000 to 4000 calories, and it converts to fat, and that is what causes obesity. And on top of it, people who take in a lot of alcohol, especially in men, that is another major cause for obesity.
So coming towards our audience questions, so sir, how can you reduce the risk for obesity?
Is the lifestyle changes. As I said, that don't overeat, and always try to keep half your stomach empty. Eat more of vegetables, a lot of fruits. Cut down on carbohydrate like rice. We are all basically rice eaters, so cut down on rice. Cut down on sugar. Cut down on bottled juices. All bottled juices, canned food, all have preservatives, all have high amount of sugar and salt. So that's the best way to is cut down on food intake, of course. And then every one of our individuals, every individual should exercise at least 3 to 4 times a week. At least take off for at least an hour or two and spend time on yourself. You're not spending on time anybody else. It's you're looking after yourself. If you want to control your weight, if you want to be healthy, you got to spend some time for yourself.
Okay. So can obesity lead to cancers?
Yes, it's very well known that cancers are very high incidence of cancers are seen in obesity, whether it is ovarian or uterine or stomach, all these colon. So cancers are pretty high in obesity. They also have, as I described, they have knee joint problem, back problems, hypertension, diabetes, heart disease, asthma. So there are plenty of problems in obesity.
So doctor, how does obesity affect social life?
Social behavior in a child, actually child stop going to the school. They withdraw from most of the friends because they start making fun of him. So he doesn't go to the school. So as a child, that is the biggest problem. And as you go into the adulthood and you become more conscious because people start teasing you, and as you grow in age, your problems set in with diabetes or hypertension, heart disease. So you're hardly able to participate in any of the social programs, whether it is a dance program or a running or a sport. You start getting into depression. So that is the major cause. A lot of patients do have depression, and depression itself can cause weight gain because eating is a habit in depression. So treating depression is very, very important in obesity. So it goes in both ways. If you don't treat depression, he continues to, suffer.
Okay, so coming towards our last question, what is the most common health risk factors of an obese person?
All, as I described earlier, most of the patients do have these diabetes, hypertension, heart disease, back pain, knee pain, and asthma. These are the biggest health risk in an obese person. And in this COVID times, of course, we've seen that very high risk for a patient who is obese, whether breathing difficulty or obesity was the major cause for COVID deaths.
Okay, so doctor, please tell our audience about the facilities provided at Apollo Hospital, Jubilee Hills regarding to bariatric.
Yes, bariatric is a very specialized surgery. A surgeon needs to be quite experienced, and the hospital needs to have a very well equipped theatre. It's a teamwork basically, and at Apollo we have a full-scale team with us, where we have a nutritionist, a psychologist, an endocrinologist, and we have all specialties available under one roof. As you know, that bariatric surgery needs, right from you have to design a wheelchair for an obese person. You have to design a commode in the bathroom, a bed which can take 200 to 50 kgs. So every aspect of bariatric needs to be taken care in a hospital, whether it is a transportation, whether it's a room which is to be designed, a theater has to be designed for obesity patients, obesity surgery. In theater, the table has to be equipped, the personnel have to be used to, anesthesia department, which is most important, has to be geared up to take care of the obesity patients, including investigations. Sometimes an X-ray machine which needs to be upgraded for an obese patient, even a CT scan which needs a wider mouth to get into the patients getting into the machine. So everything has to be looked into in a bariatric setup. So it's very, very important that you have all the departments, an experienced surgeon, experienced theater staff, experienced assistant, good equipment, all goes out for a bariatric surgery, because they are high-end surgeries, risky surgeries. Patients are overweight, so they are not ordinary surgeries, which needs to be really taken care of.
Okay. So dear viewers, we have come to the end of our session and hope we have covered all aspects. If you have still more doubts, you can book appointment with Dr. Rajnesh Reddy and clarify your doubts. Thank you, doctor, for educating our audience in today's session. Thank you for joining us. Stay tuned for more such educative live sessions. Namaste.